speaker, our Nordic speaker is the Ambassador of Health and Wellbeing at the Ministry of Foreign Affairs in Finland. She is a specialist in public health and management and has worked on policies to promote public health, social protection and gender equality at the European Union and at the global level. Päivi Sillanaukee will discuss Finnish response to the pandemic and relevant health tech innovations. Ladies and gentlemen, it's a great pleasure for me to introduce to you Päivi Sillanaukee from Finland. Can you hear us, Päivi?
Yes, can you hear me now?
Please, the floor is yours.
Thank you. Dear colleagues and participants, it's a pleasure to be here today. And firstly, I would like to thank the Nordic embassies for organizing this event. I would also like to thank the representatives from the Republic of Korea for their representations, which is very useful to be able to hear what is really happened there. And although we live here as neighbors, we Nordic countries, I already learned a lot from Norwegian colleagues. So I wait for also to be able to share our experiences then here, but also during the panel. Today I will talk about Finnish Digital Health Ecosystem and solutions for the COVID-19 pandemic. Now I would like to take the next slide, but this doesn't go. I will firstly introduce Finnish Digital Health Ecosystem. Secondly, I will talk about Finnish Centers of Excellence. Thirdly, about latest Finnish legislation relating to this topic, actually the secondary use of health and social data and new data permit authority FinData. And lastly, I will conclude with some Finnish solutions for COVID pandemic. Finnish Digital Health Ecosystem is quite unique and has a unique combination of high quality health data and an open society of trust. 100% of our patient records are in electronic format. International researchers have a national one-stop shop access to our data, including population-based biobanks, comprehensive digital healthcare registers, and electronic medical records. Finland is a global leader in digital health. Health tech is the largest and one of the fastest growing export segment of high-tech industry. We have the best availability in the world of latest technologies, scientists, and engineers. Our culture of working together creates public-private cooperation and business ecosystems that generate innovation and growth. Our ecosystems consist of companies, research organizations, cities and municipalities, government regulators, as well as innovation and internationalization accelerators working closely together for common good. As a small country, we value international cooperation and networks. For example, according to OECD comparison, Finland is top 1 in the use of electronic patient records and electronic prescriptions. The backbone of the Finnish health system are national patient record and prescription system, other extensive and good quality national health and social data registers dating from 1960s, one-stop shop for researchers to access the data securely, variety of information, self-evaluation and care e-services to citizens, and the long history of digital development and existing digital capabilities have been essential in managing COVID-19 crisis. The Finnish government is investing over 30 million euros for personalized medicine research, innovation, education, and data management centers of excellence. We are establishing National Cancer Center, PICAN, genome center, pharmaceutical center, neuro center, and enhancing the joint activities of the biobanks. The centers operating on the one-stop shop principle will form a development environment around public stakeholders, and they unite as a network all the university hospitals and the health care districts in Finland. So we have the whole Finnish population then available. And they also share experiences and the best practices so that wherever you live in Finland, you have the latest information there. Digitalization brings a new need for high ethics and responsibility. Data privacy and cybersecurity are to be integrated to the whole value chain from research to clinics, in business and all the way to consumers. We heard about the data security already from our Korean colleague in the beginning, and this really is balancing between the availability of the data, but also then the security side. In Finland, the Act of the Secondary Use of Health and Social Data and Biobank Law elevate research, innovation, and investment opportunities across health and well-being, from disease prevention to predictive and personalized medicine and new methods of treatment, with full focus on data privacy and security. Act on the Secondary Use of Health and Social Data is among the first of its kind anywhere in Europe. The new data permit authority, FinData, grants data permits if data is needed from several data controllers. FinData operates a centralized data permit system and a secure user environment for researchers. And we have now about a year experience of FinData, and they are really positive. So when it comes to the COVID-19 pandemic, next some general observations on digital solutions and health. COVID-19 has raised the need for new digital solutions that are location and time independent due to the contamination risk. For example, remote diagnostics, monitoring and consulting, remote health and social care services. The market need for new technological and digital solutions is growing fast, and the digitalization speed around the world is increasing due to pandemics. The change creates a need for new kind of players to enter the health ecosystem and challenges traditional industry silos in building business models and acquiring knowledge. So how digital services for the Finnish citizens have been integrated in COVID-19 response? Finns are active users of their own health information. 1.1 million log-ons every month and 0.5 million individuals per month visit to MyKanta, which is a national patient record and prescription system for citizens, to browse their health records or prescriptions. That is 10% of total Finnish population. During the COVID-19 crisis, we have seen an enormous increase in visits to the website of National Institute of Health and Welfare. We have implemented weekly COVID-19 self-evaluation service. I will tell you more about it in my next slide. And we have successfully launched Corona contact tracking app. We have utilized remote digital health services a lot. COVID-19 symptom checkup feature was added very quickly into the National Self-Evaluation and Care Service. It has decreased direct phone contacts to professionals, and it guides people that need further help to right professionals or directly into appointment system. And this is national. And then wherever you are in Finland, then you get the numbers which are there, the numbers you need to get to right professionals. Corona contact tracking app was launched at the end of August. It took relatively long time to develop the service in Finland, partly because we did the legislation where we wanted to guarantee data privacy issues. And that was a clever strategy, because when we then launched the application, in 2 weeks, 40% of the Finnish populations had downloaded the application. And that is really increasing, and that shows how our population has really trust on our legislation processes, but also on our institutions and government also. And lastly, I would like to show you here in these two last slides some of the solutions we have here in Finland. Some of them are then developed during the COVID-19, but most of them are, or I would say that all of them are useful also in other situations. So here you can see some virtual consultation solutions, and you can go then afterwards to those websites and learn more about them. And then here are some solutions about remote patient monitoring or remote care. So I will stop here and thank you for listening.
Thank you so much, Päivi, for sharing a very interesting background on Finnish, both experiences and solutions. So a big hand from us in Seoul to you as well.